as I said, continuing further would be the patient history and prescription management. Right now, especially with growing with age, the number of hospital visits with our modern lifestyle will increase, and number of prescriptions might increase, and we definitely will lose track of records. What was prescribed or what medications were we taking? Could be anything. I mean, we might change because of how healthcare works, and most importantly, it's also to do with the psychology of the patient. So we might change the doctors when we don't find the results for ourselves because of our own reasons as well. So uh, we also don't have the records. Even the healthcare unit sometimes struggles to keep up these records. So what if we can have, these are the challenges, but what if we can have, when the patient gets registered in a healthcare unit, all the history is captured. It could be with their personal information, that is healthcare information. What could be their blood group? Is there any history of any illness or ailments or any other prescription that they were taking? And then a doctor's diagnose, I mean, a physician diagnoses the patient's create, which is again recorded, which is then directly synced with the pharmacy. If we have an in-house pharmacy of a healthcare unit, we can directly sync over there, which where they can see, okay, this is the prescription that the doctor has given, and these are the things that we need to issue based on the customer's requirement. And finally, an invoice also will be generated. So again, we are speaking about digitizing these processes in such a way that all the things are streamlined, and most of the processes are available in real time in digital formats, rather than looking into physical copies of prescriptions, maintaining huge files and losing them altogether, and then getting lost of all the details that happened in prior. So electronic medical record is what we say, with lifestyle, allergies, and chronic diseases tagging, where we say the complete history from our birth to so far our presence. We can maintain it in the system itself. And then what are the different types of prescriptions and validations with alerts? If they, I mean, for example, if the doctors have prescribed, the customer can have their own like module, or in such a way that you have to buy this particular this thing, that is medications, or you might have to go for another vaccine, or all these things can be put out with alerts and exceptions in the system itself. And most importantly, as I said, again, taking up a printout, going to the pharmacy, and then taking over there and they generating another invoice. Rather, we can streamline it in such a way that if the patient wants to choose the pharmacy in-house of the same healthcare unit, that can be put out in such a way that they can have the pharmacy can have this particular prescription digitally available, and the patient can choose from it. So you can see another screenshot over here, where what is the blood type, what is the family, these things, and then is there insurance covered, or ethnic group, address, and all these things put out. Diseases, I mean, if there are any pre ailments, what are the medications taken, what are the previous appointments that they had put out, are there any genetic risks, lab tests, history of lab tests, lifestyle, what could be their food aspects, or it could be allergic aspects, and all these things can be put out over here. If they had any surgeries or any other aspects, can be recorded over here. Again, Odoo can help by recording all these things. That's where we want to pitch in. I mean, we want to connect the healthcare unit along with the ERP tool that is available, so that all these regular workflows of a healthcare unit is already covered in the system. So question would definitely be asked is, we consider money very, very important. So with all these history and other things, would you trust a bank that forgets your history of what transactions you did? Definitely not, right? So how can we trust the same with our healthcare unit? So we have to make sure these are available, and these are the ready, these are the solutions that should be available with our healthcare sectors as well.